We're diving into another important immunohistochemistry test, the Perforin test. This test is pivotal in understanding certain diseases and conditions, especially those involving the immune system. Let's explore what this test is all about, the preparation required, and its significance in diagnosing various conditions. Free test information. Before we begin with the specifics of the Perforin test, it's crucial to understand the pre-test requirements. For an accurate interpretation, please provide a copy of the histopathology report. This report offers essential details about the biopsy tissue's characteristics. Additionally, the site of the biopsy and the patient's clinical history are necessary to correlate the test findings with the overall clinical scenario. These pieces of information are critical for the pathologist to accurately interpret the results of the Perforin test. Specification of the test. Now let's talk about the Perforin test itself. The test is an immunohistochemistry procedure that specifically stains for perforin, a protein crucial for the function of cytotoxic T-lymphocytes and natural killer cells. These cells are integral to our immune system, as they help mediate the destruction of infected or cancerous cells by damaging their membranes, leading to apoptosis or programmed cell death. By detecting the presence and distribution of perforin in tissue samples, this test provides valuable insights into the functional status of these immune cells. Diseases associated. The Perforin test is particularly useful in the context of certain diseases. It's often employed to identify markers of apoptosis in leukemias and lymphomas. Since these cancers involve the uncontrolled proliferation of immune cells, understanding whether these cells express perforin can provide clues about their behavior and potential response to treatment. Beyond cancers, perforin expression might also be relevant in infectious diseases and autoimmune disorders, where the immune system's regulation is disrupted. Thus, the test can help in assessing immune system activity and potential dysfunction. Specimen used. For the Perforin test, the specimen used is typically a biopsy sample. This can be from various tissues, depending on the clinical indication. The biopsy tissue is prepared and processed for immunohistochemical staining, which allows for the visualization of perforin expression within the sample. Proper handling and preparation of the specimen are essential to ensure the accuracy and reliability of the test results. Components included. The test involves several key components. 1. Primary antibody. This specifically binds to perforin in the tissue sample. 2. Secondary antibody. Conjugated with a detection enzyme. This binds to the primary antibody. 3. Chromogen. This reacts with the enzyme to produce a visible stain, highlighting cells that express perforin. 4. Counterstain. Applied to contrast the stained cells against the rest of the tissue, making the results easier to interpret. Test report time. Once the specimen is processed and the staining is complete, the test results are typically available within 7 days. This time frame allows for thorough examination and interpretation by a pathologist, ensuring that all findings are accurate and clinically relevant. Test information. To sum up, perforin is a specific marker of functionally active cytotoxic T lymphocytes and natural killer cells. It plays a crucial role in mediating cytolysis of target cells through membrane damage and apoptosis. Because of its role in apoptosis, the Perforin test is a valuable tool in the diagnosis and management of leukemias, lymphomas, and other diseases where immune function is a concern. It helps clinicians assess how effectively the immune system is targeting abnormal cells, which can be vital information in both diagnosis and treatment planning.